I see a lot of people who have a lot of shame about it, where they're like, I feel like I did this to myself. And I'm like, you did not eat your way into PCOS. We don't entirely appreciate what causes it in terms of like why one person has PCOS and another does not, but it is not your fault.
Welcome to the Advanced Women's Health Podcast, where we empower women with the latest insights and advice on holistic health. From cutting-edge medical research to practical wellness tips, our mission is to help you thrive at every stage of life. Join us as we explore topics ranging from hormonal balance and reproductive health to nutrition and mental well-being. Whether you're seeking solutions for a specific health concern or simply want to enhance your overall wellness, you're in the right place. Let's embark on this journey to better health together. This is the Advanced Women's Health Podcast.
Hello, and welcome back to the Advanced Women's Health Podcast. I am Dr. Michelle Mussar, and today I'm joined with Dr. Natalie Scheer, and we're going to be talking about what we treated this week. And so a new theme that we're going through in this podcast are bringing you guys into our clinical rounds. So what's really cool about Advanced Women's Health and our team is that we have daily meetings where we're going over cases and really getting everybody's feedback, anybody who has experience with that condition, person, place, essentially, to appreciate what is any of the new research, what are all of the treatment ways or the ways in which we can look at treatment and approach the case, and making sure that we're dotting all our I's, we're crossing all our T's, that we're using the best treatment that's available. So really we're getting the mind of many for, the cost of one is kind of my tagline for this. And the other reason that we really want to do this kind of theme to the podcast is that we really want people to be able to peek behind the curtain and appreciate, what is it that we treat and what do we do? Because saying naturopathic doctor, we, work in women's health is not necessarily clear to everyone. So welcome, and we hope that you enjoy today's episode. So I'll kick us off and I'll talk about a PCOS patient that I've been treating that I saw recently. And so she's mid-30s and struggling with fertility. And so ultimately, for those who don't know, with PCOS, it's essentially a condition where we see two of at least of the three following. So we see irregular cycles, so cycles that are longer than 35 days. We see high androgens. So those are either on lab work or symptoms. And so symptoms of high androgens are going to be things like male pattern hair loss, hirsutism, which is dark, thick hairs on the face, nipple, abdomen, essentially, again, like male pattern hair growth, and that we're seeing very small but multiple cysts on the ovaries, and those can be seen on ultrasound. But it's not just seeing a cyst on the ultrasound, it is seeing a very specific type of cyst on the ultrasound. And so with PCOS, more often than not, we're seeing these irregular cycles. And so one of the things that I actually find that I do often when I have a patient who's coming in and they're already kind of leading with, I've been told I have PCOS and I need support for this, is I'm really trying to gently challenge, is that an accurate diagnosis? And not necessarily because I'm trying to invalidate anybody's experience at all, but it's just grossly overdiagnosed. I'm seeing everybody and their cousin come in saying they have PCOS, and it doesn't fit everyone at all. And so some of the interesting questions that I find that I'll use to get an appreciation for things is, when did the cycles become irregular, right? Were they irregular from the very beginning? Did they become irregular at a later point in time when, metabolically things started to shift, right? So oftentimes we'll see that a teenager was, a varsity athlete and they played lots of sports and diet was really on point and their cycles were super regular. And then they graduated, they no longer played that sport, weight, was put on, diet changed, and then suddenly the cycles became irregular. And so that can be an indicator of that being the case. But alternatively, we also want to make sure that, again, are people under eating? Because there's something called hypothalamic amenorrhea, fancy word, that essentially means that the body doesn't feel safe enough in order to ovulate. And so not safe enough can be that we don't literally have enough body stores like a fat to be able to safely procreate, and therefore we're just going to halt ovulation, or that the body is too stressed for reasons that are unrelated to food intake. And again, not necessarily safe enough to procreate, so we're going to halt that egg. And so it's really important to be asking a number of questions around what's going on when people are like, their cycles have become irregular, because there's a number of causes of what that could be. This is an aside, but we also see a fair amount of premature ovarian insufficiency, which is a fancy word for premature menopause. We're seeing more and more of it. Dr. Natalie, do you have any experience with POI? Just you are our menopause expert.
I do. I mean, that's what I see consistently day in and day out at the clinic. And actually, not necessarily, I haven't seen a lot of POI in my practice, but I have seen a lot of people entering menopause at an earlier age than maybe the expected age, right? And so we know that the average age in Canada is 51 to go through menopause, and globally it's 52. So kind of that age of 51, 52 is when we kind of expect our menses to stop, right? And menopause, for all those who are listening and maybe don't know that exact definition, is after 1 year of not having a period, identifies this as menopause, right? Going that full year. And so I often have a lot of patients who come in to see me earlier than 51, 52, actually in their early 40s, right? When they're kind of saying, hey, I think I might be too young for this, but I'm actually think I've gone through menopause, or I'm going through menopause, or I'm about to, right? And that kind of like, maybe they're not sure of that definition either. And they're kind of just wanting clarification and education when they step into my office. And so I have a lot of patients who don't know why that they are starting to see changes in their cycle at an earlier age, right? They're not identifying as old, right? A lot of people think that when they go through menopause, they have to be older, maybe in their 50s. And they're saying to me, I feel so young, I'm only 40, 41, 42, but my cycles are starting to change. I'm getting a lot of anxiety, brain fog, sleep issues, a lot of weight gain that I've never had before. And there's that conversation of what could have caused this, right? And so we know that below the age of 45, we always want to do blood work to rule out what else is going on, right? You mentioned POI. We want to kind of look at the hormones that our body is producing, especially at that time. So FSH, we want to see, LH, we want to see estradiol. We kind of want to check those hormones. But in addition to that, we want to look at thyroid, right? Because a lot of perimenopause symptoms can mimic some Hashimoto's, for example, which is an autoimmune condition for the thyroid, or hypothyroid. We also want to look at, any nutrient deficiencies that are possibly there, as well as insulin regulation, which will tie into a lot of the things that you go through and treat through PCOS.
Yeah, there are a lot of overlapping contributing factors that are going to contribute to both perimenopause and menopausal, the journey not being so smooth, and to PCOS and what drives those things. Because essentially, again, when we're looking at PCOS, we're three of the biggest factors, granted there are others, are going to be appreciating what's going on from an insulin perspective, what's going on from an inflammation perspective, and what's going on with androgens in particular. But we know that stress is also going to be a big factor in there as well. And so much goes into all three of those things. But I would argue that androgens slightly less so, but still important in that window of time. But everything else that I mentioned are all going to be crucial cornerstones to supporting women in that menopausal period of time. And again, just to define perimenopause for those, it's generally the 8 to 10 years prior to that full 12 months without a bleed, where we can see all of those symptoms. And so POI is going to be when, we see the absence of the period before the age 40, like early menopause, which should be between 40 and 45, and anything after 45 would generally be considered, standard. And I find we're seeing more and more of that, more people in their even mid to late 30s, early 40s who are like, what's going on? This feels like way too soon, or what's happening from this respect. I've had a family member who was like, I'm hot flashing and I'm only, 38. What gives? And I'm like, well, there's a lot that can be kind of going in there. So with that being said, can you enlighten our listeners in terms of what's going on from an insulin inflammation perspective when it comes to how you treat?
For sure. So especially talking about kind of that early perimenopause window, like especially from 37 to 42 or 37 to 44, kind of in that window, is a lot of those patients that I will see in my office where they are still cycling, they're still getting their period, but now it's starting to become a little bit more erratic, right? Periods are starting to be a lot heavier. A lot of women say, I used to be able to use a regular tampon and never a liner, and now I'm bleeding through super tampons and having to wear a pad. And now I'm nervous when I stand up, or if I'm at work, that I'm actually going to be bleeding so heavily that I have to be conscious of what I'm wearing at work, right? And so that often brings a lot of women into my office, kind of like question what's going on. And of course, like I alluded to before, is that we do want to run full blood work, right? And one of the ways that we look at insulin resistance, and that's kind of like a topic of conversation that we're having today, is to do the insulin glucose challenge test. We both run it so much with all of our patients, and a lot of practitioners do at AWH, but it really is a gold standard test to look at what your body is doing. So how much insulin is your pancreas producing to control the blood glucose that's going on in your body? And so I really explain it to patients like that. I walk them through what to expect at Life Labs when they're getting that test done. But women really love to see those results, especially I have a lot of data-driven women enter my office. And I'm sure like attracts like, right? And so those women kind of like to see those numbers on their blood work results. And I really walk them through it, right? How is this test mimicking what they're eating kind of in their regular day-to-day life? And then how can they change their diet strategies and nutrition habits to balance their blood sugar a little bit more, to decrease insulin resistance? Because we know when estrogen decreases, insulin resistance goes up. And so that's a contributing factor to why a lot of women are gaining weight in their midsection. And I really have this conversation with women, and sometimes it's just diet changes that people need at first, right? Because I think we were kind of talking before we went on air here, is that we see a lot of patients that are in this early perimenopausal window, and they're having some, weight gain that's beginning that they're not used to, especially in their midsection. They're having some sleep issues, right? They're not able to stay asleep like they used to before. They're having some brain fog. They're having some increased anxiety, but they're not having any vasomotor symptoms. So that's something that I really talk to patients about lifestyle habits, right? So it's like educate on diet, protein, fat, fiber, educate on how we need to start to build muscle, change the way that we're exercising. Our muscles really start to degenerate around this age, and we need to proactively do something about it. And then even for anxiety, do we need to, add adaptogens into their treatment plan to calm the increased anxiety that we're seeing, right? Do we need to support sleep in a way? Maybe we're talking sleep hygiene, we're talking supplements, all these things. And sometimes that's all we need before we even have the discussion of hormone therapy, because a lot of patients will do this, we'll have this discussion, and then we will treat all of these symptoms through diet, exercise, supplements, and then they won't need anything further. And then I'm like, okay, great, you're on a great track. And then when you start to get hot flashes or night sweats, or if you do, not if, when, but maybe if, we can revisit the conversation of hormone therapy if needed.
100%. A couple of things I wanted to touch on that you mentioned. The insulin glucose challenge is really helpful because I don't know about you, but I get a lot of questions about like, should I be intermittent fasting? Is that a good thing for me to be doing? And again, I see it a lot in those two populations, those who have PCOS and those who are in that postmenopausal kind of window where they're like, what do I do? Because everybody and their cousin is saying we should fast or it's the worst thing ever. And so the insulin glucose challenge test is really helpful because essentially it entails drinking a sweetened beverage and then seeing how your body responds both in terms of insulin and glucose over time. And so it mimics, again, as you said, what's happening in our fed state, because we spend the majority of our time, at least during the day, in a fed state. And for some people, more than 50% of their time in a fed state, meaning that they're eating beyond, a 12-hour feeding window. And we want to know what's going on metabolically during that period of time. And what happens with the insulin glucose challenge is that depending on your pattern, because what we've come to appreciate again in clinical rounds and just with the number of insulin glucose challenge tests that we do, is that there are like a bajillion different patterns that can show up in there. And they really do influence and dictate how we treat people. Like there isn't a cookie cutter approach here. It's, what's going on at your fasting state. And if your blood sugar is incredibly low and like is problematic, then no, fasting's not going to be good for you because you're going to end up anxious and shaky and jittery and feeling like you're going to drop, which is valid. You're not accessing glucose at that point in time, which could happen for a variety of reasons, whether we have fat stores or not. But nonetheless, that would not be appropriate. Granted, people who are waking up and have very high fasting insulin, very high glucose, then again, fasting is going to be super indicated in those people, right? And so the testing can be really helpful because it really does drive how we go about treating these individuals, because inevitably, there's 1,000 different ways that you can approach PCOS. I see a lot of people who come in and they're like, well, the internet told me I needed to take inositol and berberine. I've been doing that and nothing's changed. And I'm like, well, what else is going on here? And I would also really argue that with PCOS, I see a lot of people who have a lot of shame about it, where they're like, I feel like I did this to myself. And I'm like, you did not eat your way into PCOS. We don't entirely appreciate what causes it in terms of why one person has PCOS and another does not, but it is not your fault. But we do know, or I very much see clinically, that if insulin is a big part of the equation and we're not addressing nutrition, that we're not going to get better no matter how many supplements we take, right? You could be doing the world's, cream of the crop kind of supplement regime with all of the things and spending quite a bit of money, to be honest. And if we're not addressing that part meaningfully, like you're just not going to get results. And I would argue the same happens with, again, perimenopause and menopause, that like it's so important.
Totally. And I agree with you, is people often ask me in the first visit, do I need to fast or not? And I'm like, well, actually, let's run some blood work. Let's get the data. And then we can actually treat you in a way that is better for your body, right? Because
100%.
the insulin glucose challenge test will tell us whether or not you need to fast or not. I will say that most of my patients probably do need to fast, especially when they're insulin resistant, right? And so we had that discussion. We want to fast at least the 12 hours overnight, right? And then sometimes we can push it if we need to 14 to 16 hours. And then we can talk about what's realistic for them. But a lot of the time people want that answer because of social media, or influencers tell them that they need to be fasting in order to lose weight. But some people don't need to, right? If some people, like you were saying, kind of reach hypoglycemia easier than others and need that blood sugar balance of protein and fat and a complex carbohydrate possibly, then they need that, right?
Yeah. Well, and exactly that. The other piece that you mentioned is the importance, and I mean, we've covered again, is the importance of the nutrition when we're talking about approaching insulin resistance. But I would also argue that, 40 to 60% of our body's insulin signaling is determined based off of gut bacteria and hormones, incretins, which for those who are listening, incretins, GLP-1s, so things like Wegovy, Ozempic, Mounjaro, all of those kind of medications at this point in time are, again, addressing that component of things. So if overriding, if you will, but that nonetheless, it's really important when people are like, okay, but I'm eating super well and I'm going to the gym and I'm doing the things. And I'm like, has anyone ever looked at your gut, right? Like, has anyone treated or approached this in any kind of meaningful way? Because ultimately treating gut health is nuanced. As we know, we went through a couple of GI map or of comprehensive digestive investigative tests this morning, some of those sample reports as a team. And what we saw is that like, there are so many, again, different patterns as to what can be going on. Stress is going to play a role. Fiber is going to play a role. Again, infectious history, so on and so forth, what your immune system is doing. But there are a bajillion things that are going to play a role in your gut health. And it makes up such an important, again, cornerstone of insulin resistance and blood sugar balance. And so this is, again, why the beauty of working with a naturopath is that the research shows that the more time you get to spend with your care provider, the better outcomes are. Who knew, right? Shocking to all of us that if you actually have all of the pieces of the puzzle, it's easier to treat, truthfully, because I can only imagine if I got one piece of information, one data point, right? Like that I just have hot flashes or I just have acne, how challenging that would be to treat when we're not actually like approaching like, but how are you sleeping? What is your stress like? And do you move your body? And how much time do you have for any of this, right? Like, because nobody does all of this stuff perfectly, nor you or I imagine. I can speak for myself. I don't do any of this perfectly, but it's just, again, about appreciating like what are the big two or the big three in terms of the things that are contributing to your health, and then how can we reasonably go about approaching and treating those so that we can see meaningful change.
And you don't need to be perfect all the time. Sorry to interrupt you.
No, amen. No, that's great.
And I always make sure my patients know that, especially my patients who are all or nothing individuals. I get that a lot, right? They either say like, I'm good for a couple of months and then I just fall off track and I can't get back on. And that's my issue. And sometimes it's just a mental battle, right? For them, like talking to themselves and having that internal dialogue of saying like, we don't need to be perfect. We just need to make these changes, whether it is adding more protein into our diet, right? Fasting a little bit more, eating 3 meals a day instead of snacking consistently throughout the day. What are the changes that we need to do in order to balance your blood sugar to make you feel better, if that's what we're doing and working on, and then if you fall off the wagon for a day or two, we can get right back on, because we want to make sure that those habits are easy and realistic. So then it doesn't seem like a huge and overwhelming struggle to kind of get back on and initiate healthy habits.
Yeah. Well, and inevitably when people are like, don't touch the shiny red button, right? Like don't have any carbohydrates. You're like, well, guess what I can think about right now? Like only carbohydrates, right? So it's also about making things sustainable, because I think that there are a lot of all or nothing characters that are on the internet right now that are kind of pushing certain models, and they aren't sustainable, right? And truthfully, I think it can be quite damaging when people attempt things and then feel like they failed at them, because then they're like, I can't do it. I could never do it. I don't have enough willpower. I don't have enough self-control. And truthfully, I think that's really damaging, because at the end of the day, if you lose trust with your integrity, with your ability to keep your word to yourself, like it becomes a little bit one of these like self-sabotaging things, which I also see a fair amount of, right? Where people are like, I just don't trust that I can do what I need to do to take care of myself. And I'm like, again, the goal isn't to make for unrealistic plans so that people can actually accomplish them. It's being really honest about where your capacity is at. And again, being strategic about what's actually going to yield the biggest outcome to increase your capacity so we can build on these habits and changes. And again, make sure that they're sustainable, because I'm like, I also indulge in like treats and yummy things and whatever that aren't necessarily in alignment with my insulin being super well balanced, but it's part of me being emotionally and long-term healthy, right? Because I'm not binging, because that's another thing that I see very frequently in practice. I don't know if it's part of yours, but I treat a number of people who have a really poor relationship with food, whether it's frankly disordered eating or not, where there's a lot of restriction that happens. And then inevitably we binge at the end of the day, right? That it's just like everything kind of goes out the window, and it's like, well, I'm doing this for the sake of X, Y, and Z. And I'm like, yeah, but like eating more during the day is actually in alignment with your goals, because you're going to have better energy. Your blood sugar is going to be balanced, which is a big driver of mental health. People don't appreciate that there's a decent body of research that shows that you can't have some degree of mental health, challenge and not have some degree of insulin resistance when we're talking about anxiety and depression. But two, like if your blood sugar's on a roller coaster ride, if it hits a low, your body's like, I need fuel now. And when you're doing that, it's not looking for carrots or a chicken breast, right? And so we're looking for fast fuel, but it keeps us on the roller coaster ride. And so oftentimes it's really, again, about being really targeted and focused about where can we make a change that's actually going to be in alignment with your goals, that might be counter to everything you've been told or learned before. Because a lot of people are like, what do you mean I need to eat more to lose weight? And I'm like, no, but look, if this was going to work, it would have worked by now, right? So it's just about being really strategic about what that looks like.
Exactly. And I actually do see a lot of binge eating in my practice as well, or just overeating at night. Right. And that's
Mm,
that conversation that I have with women, is that we want to kind of reshift the food that we're consuming earlier in the day, right? We don't want to always consume like majority of our calories at nighttime, because then in the morning people aren't hungry for breakfast, right? And those are a lot of the women that say, I'm just not hungry. I actually don't eat that much during the day. However, weight loss is a goal of theirs, right? And so we kind of have to find like, okay, well, where are we consuming the food? And usually it's nighttime snacking or eating or binging, right? And so we kind of have to shift that mental perspective of not eating throughout the day is good for me. We have to kind of shift it to being like, let's fuel our body for the day for the activities that we're doing.
100%. 100%.
Today's episode is brought to you by none other than Advanced Women's Health. If you are interested in diving in deeper to your health, if you are finally ready to feel like yourself, and you are finally over hearing everything's normal, everything's fine, and you want a deeper dive into your healthcare, then we are here to help you. We are currently helping patients in British Columbia and Ontario, Canada. But don't worry, if you're in another province, still reach out, get added to the wait list as we expand coast to coast. We cannot wait to work with you. Check out the show notes for more information on how to get started.
One of the other things that I think that we almost touched on, but I'd like to kind of bring some light to, is the importance of muscle mass in both of these populations. And that it's something that I think really isn't stressed enough when we're talking about perimenopause and menopause in particular, but again, is going to be hugely beneficial, truthfully, for everyone. Exercising is one of very few things that reduces what we call all-cause mortality, which is literally dying from everything, which is pretty cool in the grand scheme of things. But metabolically, muscle is one of the most important things you can do from a proactive perspective, I would argue, as we're heading into later stages in life, because muscle is going to be protective, again, for making sure that our bones are strong and dense. And so we're less likely to suffer from things like osteoporosis, which is literally just a fancy word from like weakening or more brittle bones. And it predisposes us to things like fractures and breaks, which come with their own kind of consequences. And so it's going to help from that respect. It's going to help metabolically when we're talking about the insulin and the glucose piece and the metabolic component of what's going on. It's going to improve cardiovascular risk factors down the line. It improves mental health. Like, it's one of these things where like I feel like it isn't stressed enough how important not just exercise, but specifically resistance training, having muscle on your body protects you in terms of like if you have a cancer diagnosis, that you are more likely to have a better outcome and survive if you have muscle mass, right? Because fat goes quick and can lead us down some not so pleasant roads when we're talking about cancer. And so it's one of these things where like having muscle is so important in resistance training. So literally picking up heavy things and putting them down is really crucial to that. And again, cardio helpful, walking helpful. I never knock those. Pilates, yoga. I argue that all of those are really important. But I think specifically as women, we're conditioned to be afraid of the gym, that we're afraid of lifting weights, that it might make us quote unquote look bulky, which is funny because it takes so much effort to look bulky. But that, yes, resistance training is so important. You must see a fair amount of that in your practice as well.
I have that conversation probably 4 times a day about muscle mass because you're right. As we start to get older, our muscles start to degenerate. As painful as that is to hear, unless we're doing something about it. And that means we have to eat enough protein and do resistance training, right, to make our muscles strong. And we lose a lot of our muscle mass through that kind of window that we see that menopause occur. And we've all seen women who are older in their 80s or 90s where they're frail, right? They fall, they may fracture a bone, or they don't have the strength to do the daily activities that we would normally be doing. And I always kind of shift people's perspective who are in front of me to that. It's like, we don't want to go there. How can we prevent that from happening? And the way that we do that is by making sure that we are lifting weights. And I know you kind of mentioned like lifting heavy things, right? But it's really important for women to know that they have to lift close to failure. 1 to 3 reps shy of failure is really important. And so I always kind of explain this to women is I ask the question, like maybe they don't feel comfortable going to a gym, right? Because they're kind of feeling self-conscious. And I 100% actually agree with that. Sometimes that's a huge barrier for people stepping into the gym. And it can just also be an environment that's not the most welcoming for a lot of women. And so, but I had this conversation about we need to get you onto a plan that you feel comfortable, that you feel safe lifting weights. You know what to do if you don't have any experience lifting weights, right? Proper form. I don't just want to give the advice of saying, okay, now we have to do resistance training because muscle mass is important. And we have to give patients a plan of how they're going to do that, or else they're going to leave my office and say, she told me to lift weights and I'm going to be lifting the 2 pounds that I have at home. And I think that's good, right? No, we really have to explain what that means. We need to progressively overload, meaning that you're going to get stronger quicker. And that if you have 5 pounds and you're doing a bicep curl with that, you're going to need 10, you're going to need 15, you're going to possibly need 20 pounds. Like you're going to get stronger. That's not to say that you will consistently be lifting heavier and heavier weights always, or probably find a weight that's going to be challenging for you for a long period of time. But we also don't want to be doing light weights and lots of reps, right? So we really have to explain to patients that's just going to create muscular endurance. We really want to create strength, and that's lifting close to failure.
So important. And I really love that you reinforce the importance of good form. I recently had a discussion with a physiotherapist friend of mine, and she was talking about how people's proprioception, so where their brain knows where their body is in space, is actually quite compromised in people who have mental health challenges. So when we're particularly anxious, our body is in a fight or flight state and doesn't necessarily is operating entirely differently. Our frontal lobe, which is responsible for like rational thought, isn't necessarily online. And our primitive brain, our brain stem, is kind of like in the driver's seat, if you will. And in that situation, we're not necessarily as preoccupied with good form because, again, when your body is in that fight or flight state, we're just trying to run away from the metaphorical bear or fight the metaphorical bear. And in most day and age, that's not a thing. In Sudbury, we have more bears than other locations, but we're not actually generally, that's not the cause of our stress response. And so isn't necessarily appropriate. And so all the more reason why, again, having a tailored approach in terms of making sure that we're dealing with that stress response so that we can actually safely do activity. We can safely know where our body is in space so that we can adopt good form, and then making sure that people are supported in that, right? Fortunately, in Sudbury, we have a number of spaces that are actually really inclusive and really safe for people to learn and aren't, your standard run-of-the-mill gym. Nonetheless, I know that that isn't available to everyone everywhere. And so it's really important to be having those conversations. So it's really cool that you reinforce the importance of that because it is so crucial to have details even within that recommendation.
Well, I'm sure you know as well, seeing patients day in and day out, is that you really have to make the goals in the appointment and give them a plan so they know what they're doing when they leave your office, right? They're not just kind of given this broad goal of, okay, now I'm going to be doing more resistance training. It's like, what are you going to follow? How many days a week are you going to be doing this? And what kind of time allotment do you have throughout the week to do this? But I also wanted to talk about how important cardio is as well. Resistance training is super, super important. But sometimes I think that especially for me, I have to catch myself in my appointment and say, like, yes, resistance training, I really want you to do this. And I emphasize that because it's so important for muscle health, right? And we know that people who have more muscle in their body are going to be burning more calories, at rest than the person who has more adipose tissue. But we also don't want to forget about how important cardiovascular training is for our cardiovascular system, right? So we know that 150 minutes of even low intensity cardio is what's recommended for people in a week. And so that could just be like brisk walking, right? It doesn't have to be running on the treadmill and in addition to lifting weights, that doesn't have to be there. But just to know that we do have to be moving our bodies in that kind of low intensity state as well, in addition to lifting weights. And that's what's probably going to allow people to kind of hit their goals. And like you were alluding to, like Pilates and all these things, I always say baseline, any kind of movement is going to be beneficial for somebody. So
Preach.
is this my preferred approach, is to make sure that you're lifting close to failure, you're doing resistant training, you're getting, stronger muscles, you're developing your body in that way and changing body composition and adding 150 minutes of cardio, 100%. That's what I would love for you to do, but that's not what's realistic to everybody. Some people are just taking the step of getting themselves off of the couch or off of their, chair in their office from sitting 8 hours a day. And if swimming is their preferred mechanism, like of movement, or if jumping on their trampoline or going to a Pilates class or doing a YouTube video, any movement is going to be better than no movement, right? And so sometimes people get in like thinking, okay, there's so many options. I'm just like, just do something. If you can't decide in that day, then just do something, do any kind of movement. But that's why, again, kind of going back to making a plan in the office of what their plan is going to look like reduces the overwhelm that some patients have.
100%. No, any motion, and again, like this isn't entirely what you said, right? Like that this isn't to bash any of those other forms. And this conversation also isn't meant to overwhelm anyone, right? Where like the goal is like, yes, this is like the cream of the crop. I always make people kind of like the plan, right? Where it's just like, this, I'm going to talk to you about what the gold standard, like the best thing that we could do is, and then that very much may not be like applicable or doable for you due to injury, due to pain, due to mental health, or a variety of just dislike, right? And that's okay. And so it's just like, okay, and so then what's realistic, right? Under this umbrella, like how do we tailor this specific to you so that you feel empowered, you can make a change, that we can rebuild that integrity, that you can learn to trust yourself, and we can actually start to see some progress on this. Because one of the things that I find I do a lot of is actually helping people find the realistic way through this, because they're like, no, I can totally do this. And I'm like, okay. And then they have at it and they come back and they're like, nope, like didn't work. And I'm like, did it not work, or could we not do it? Right. Because those are two very different things. And then just having the conversation around, okay, where did the wheels fall off? What did that entail? Because alternatively, I also have a number of patients who are like, give me the gold standard plan, and we do it. And then they come back and they're like, I've never been clearer. I have more energy now than I have in like 20 years. Basically like the cloud is lifted, the fog is lifted. I feel fantastic. And I'm like, sweet. Like the plan works when we can do the plan. And for some people, like, again, we just have to take it a lot more gradual. And for some people, they've been at this in terms of disease progression or like things getting bad for long periods of time. And I'm like, we don't walk, 10 kilometers into the forest and then walk out in 5 steps, right? Like sometimes it does take some effort to get out. And I think even just explaining to people what realistic expectations are, especially given their labs, because that also helps to qualify for us. Like, again, like how deep are we into this, and how intensely do we want to do things? Because I will talk to people about some of the, I would say more intense, but I don't mean to use that language, but the more rigorous treatment plans that we have, and the more gradual but equally effective, just takes longer plan. And just, again, setting realistic expectations so that people don't throw in what I lovingly call the F it towel, where they're like, I've been doing this, for 2 weeks, 3 days, 3 months, whatever. And like, I'm not seeing a change. And like, obviously our goal is to get people feeling better, to get some type of a win in between visit 1 and visit 2 in those 4 weeks, that we want to see something happen and change. And that does occur with the vast majority of people. And when it doesn't, it's oftentimes because there was an issue initiating the plan. But also just setting really realistic expectations about when somebody has I don't know why weight loss is such a big topic of conversation for me today, but like if they have a significant amount of weight to lose and they're like, okay, well, nothing's really happened. And I'm like, okay, well, did you stop gaining? Because like that's a win, right? Like, have we seen a couple pounds come off? Like that's a win. Like we have a lot of really unrealistic expectations of like what's supposed to happen and how fast. And just again, appreciating like what are all the areas of dysfunction that exist in your life, right? Because if you've got, 5 kids, they're all in sports, you're working like a hamster on a wheel, and we are struggling to eat well, then I'm like, again, like we have to take into account like how realistic is it for us to see certain changes in at what period of time, just so that people also keep with the plan, right? Because it does make a really big difference when you have realistic expectations. And it's not always what people want to hear, which is unfortunate, but I'm also not going to lie, because I also don't think that serves anyone. I don't know if you find that you're having those conversations too.
Exactly. Well, there's so many things on social media that will sell you a 6-week plan to lose 20 pounds, right? But oftentimes what's in that plan is not realistic and not sustainable, right? And so a lot of the patients have tried those things, and that's why they're sitting in front of me, because they really want a realistic and sustainable plan. And so I really like what you're saying, is that timeline is super important to have that conversation with patients, right? We need to give time for patients to achieve their goals. It has to be realistic. You are not probably going to build the muscle that you want in a week, right? It's just
No.
it took you X
Well,
amount of time to get to where you are. We have to give a longer period of time and do things consistently, and that's why we need a realistic and sustainable plan.
and consistency builds the canyon. I tell people, like you could eat perfectly, right? Like you could be having sardines and vegetable, like and like the most nutritionally dense food for the day, and going to the gym and having like the best CrossFit exercise, session of your life. And then if everything around that goes to poop, then it doesn't really matter, right? So I tell people that like your 100% is going to look different from day to my 100% looks different from day to day, right? And so some days, like I'll tell people like I always keep veggies in my freezer that are frozen. And on the days where I'm like, ooh, we pooped the bed in terms of planning, I'm like, you best believe peas go into water, into the microwave, but like they're on the plate, right? And so it's just finding and strategizing and quite frankly planning for when things aren't going well is part of what we do. Small, consistent changes count, and they actually move us more meaningfully towards our goals than doing things perfectly for a day, a week, a month, even a year, right? And then if we abandon all shit, then like for what, right? So I think a lot of the plans that you were talking about, the 6-week fixes, not only like do they work through means that are questionable, but two, they actually can do more harm than good, right? Like when we're talking about incretins and gut hormones and all of that, we know that yo-yo dieting is actually more harmful to people's metabolism than they are helpful, because they're not sustainable and they shift a number of things that can actually create more chronic issues. And that's not to say that they can't be fixed if you're one of these people who are like, oh, I've been yo-yo dieting, I've done Bernstein, I've like, if there's like a fad diet, I've tried it, that you don't need to be on the down and outs. Like we can support you through that. But I actively try to coach, especially younger folks, that I'm like not to do some of these things, because I'm like, they actually set you up for failure down the road. Like you might get, a little bit of a reward short term, but long term, they're actually going to be problematic. So to abstain and avoid those. So if anything, I think the big takeaway that we're both kind of stressing in this moment is that having individualized care is really important. Having testing done and appreciating like popping the hood, having a look at what's going on in your specific health, and then tailoring a treatment plan that is specific to you, that is going to be realistic and achievable, making sure that's a negotiation between you and your provider so that it's something that you can actually do, is just so crucial and such a key component to treating anything that you might be, have going on at this time.
Totally. And I even shift that conversation to my patients as well and say, think of exercise as a supplement. You want, or like a medication or a pill, right? If we bundled all the benefits of exercise into a pill, something that can decrease cardiovascular risk, decrease cognitive decline, decrease risk of osteoporosis, right? Decrease low mood, decrease anxiety. Those are all supplements that we're taking. And obviously I'm stretching it to a point, right? But it's kind of like exercise. Think of it as like a supplement. If you're going to take all of your supplements, if you're going to take your prescription medication, this is another supplement that we have to do. It just might take like 20 to 30 minutes to take that supplement. But all of that will do so much benefit to your body, maybe more than some of the supplements that we're taking, right? Maybe. I mean, we'll see. But there's a lot of added.
Yeah. The reframe is so important. I talk to people about that all the time, that I'm like, we really have to pivot the way we look at diet, the way we look at movement in particular, because again, as women in particular, I find that the narratives that we have been fed relative to those have been really unfortunate, is the kindest word that I can think of. And so eating well and exercise are like therapeutic gifts. They're not supposed to be punishments. They're not supposed to feel awful and crummy. And depending on, again, what's going on with all of that, this is where we can bring in additional supports, because there are some limitations to what it is that we can do. And so I'm a big advocate for psychotherapy, for counseling, essentially to unpack some of those things, because sometimes that's like a really key component of all of this too. But I couldn't agree with what you're saying more, that it's so crucial.
Yeah, I agree.
Do you have any kind of final thoughts before we wrap up for today? I was curious if you had any big takeaways that you wanted to share, or if that felt like that was our pin on today.
I think we had a great discussion. I mean, consistency is key. And that's what I tell a lot of my patients, as boring as that is, when it comes to exercise, when it comes to diet, perfection is not what we're aiming for, right? Would it be great? Yes, but it's not realistic. And so when we're consistent with our exercise, when we're consistent with our diet, when we're consistent with taking our supplements or our prescription medications, oftentimes we see a lot more results than people who kind of do that for a week, fall off and do it for another week, right? I think we both kind of were talking about that, but that's pretty much what I want patients who are listening to this to really take away from it. As unsexy as it is to be consistent, it really is so, so important.
Yep, I couldn't agree more. I use that language with them too, where I'm like, this isn't the sexy plan at all, but it's the one that works. And so thank you for everyone for tuning in and listening today. We really hope that you had at least one key takeaway, something that resonated, and we will catch you the next time. Have a good one.
Thank you so much for listening. I hope that you had as much fun as we did. And if you loved today's episode, share it with a friend and leave us a review. That is how we spread this message, and that is how we are going to revolutionize healthcare in Canada for women. Have a beautiful day and be well.